What do you think of when you think of mental illness? All of us have seen the mentally ill, maybe given them money or looked away. Maybe they are family members or even ourselves. All of us have probably been touched in some way by mental illness. During the 20th century BC in ancient Egypt, the first documentation of mental illness and its treatment occurred. Regarded as magical or religious inflictions, treatments included performing rituals or prayers to various gods. With monotheism, mental illness was considered a problem between an individual and God, a demonic possession or a punishment. These unfortunates boarded the ship of fools, were chained, beaten, or placed in asylums such as Bedlam, where spectators paid to watch inmates as entertainment. Around 600 AD, Islam was spreading through the Arabian Peninsula and beyond. These believers thought the mentally ill suffered from physiological disturbances and must be treated humanely. The first psychiatric hospital was built in Baghdad in 705 AD, and physicians studied psychology, pharmacology, and neurosurgery. They defined mental illnesses and treatments that were later translated into Latin and helped to effect change in medieval Europe. In Western cultures, even with reforms and improved intentions, treatments included bloodletting, severe electric shock, and lobotomies. Finally, in the mid-1900s, thorazine was discovered to treat schizophrenia and lithium for manic depression. With psychopharmacology, psychotherapy, and diagnostic manuals, the treatment of mental illness was becoming more standardized. I was curious to see how religion and culture continue to influence treatment as well as how they manifest in the illness. So during a recent trip to Yemen in the Middle East, I was given a rare opportunity to film in their first and largest mental institution and observe firsthand how East and West are similar and how they differ.
This is a non-governmental institute.
So this is a private facility.
Yeah.
How is it funded?
It's Islamic.
Islah Party. It's related to Islah Party. It is financed by, traders, like institutions, traders like this. It has no specific funding for it. We take from people here, but it's also, it's only a small number of the cost, small percentage of the cost, not all the cost. But, most of the patients here are paying money.
Do you feel that only the wealthier families can bring their families here? Or does it also serve the lower class?
No, they are serving the lower class because we do a lot of discount. Sometimes people, if they do not afford money, they admit here without money.
Okay.
Yeah.
Do you have such a thing as medical insurance?
It's the problem for us. There is, in the parliament these things. Yeah, but it takes time for approval.
Right.
There is some small proportion of homeless, but it's not big, because also affected by culture. Even if the patient is schizophrenic, their family supporting them. We have a lot of difficulties in treating the mentally ill, and one of them, the biggest one, is they do not come for treatment. Or most of the mentally ill do not come for treatment. They are doing different things. They are reading Quran on them, like some religious experience. They are giving them herbs, and they are doing some things else, which is, very bad behavior for the patients, like hitting them sometimes.
He was chained.
At his home, his family did this? Oh.
I just
Can you ask him why he's here and if he's doing okay here?
ليش أنت موجود هنا؟
عالج
تتعالج.
تجيني ما نرود أننا وحدي وما أرغب رجعنا
أيه.
أرقد وحدي واجنا وحدي نرود وحدي أشتي ونيس ذكروا أنت واحد ذكر واحد
Whoa! He said he went nuts because he sleeps alone. He needs a partner.
The problem in Yemen is that we do not have a stigma, a social stigma for the mental illness. We don't have it. We have that the people do not know about the illness. DSM-4, according to the DSM-4 criteria. Now, if you say from the neurotic side, most of the diagnosis is depression. But from the psychotic part, it's about equal about schizophrenia and bipolar disorder.
Okay.
We notice more men, but there is reason for that. The reasons is that females affected more by culture. They are not bringing women to the hospital. They are treating them as a traditional healer, or most of the time they close her. They close on her from the house.
What brought you to the hospital?
جابني أخي هو متعصب is crazy هو crazy هو
Her brother?
Her brother is the crazy.
It's a shame to have a patient, a woman patient, so they hide it in their home. Very few can come here.
Basically the same delusions, I mean, but it is affected by culture, it's affected by religion. Here, when there is a manic patients, most of the time they are calling themselves as prophet or as a Mahdi. You know about the Mahdi, Al-Mahdi. This is the prophet of the last period of time. He's coming and make peace on earth.
He's an angel from Queen Sheba. Excellent.
He
Tamam.
just found himself here.
Oh, okay.
كله بن اليامن
Huh?
بن اليامن
اليامن.
ابو شيلهم احبار كلهم
Ah,
كله بن
you speak
اليامن.
English.
ايوه
Okay.
Jesus and Moses is between them.
Jesus and Moses.
انا في شويه اختبار من السبع المفتي هذا يجيني من السبع انا اسال فوق يجيني خبر ايوه انا كان في رؤيه كل هذا رؤيه عن النصراني عن اليهودي عن هذا كله انا في رؤيه امريكا جورج بوش فيه علم
George Bush.
نعم فيه علم جورج بوش مسلم
George Bush is a Muslim.
اسلام في
Do you ever hear about aliens from other planets?
Yeah, it's not a common thing here.
Not common here.
Not common.
What about implants? That someone has implanted something in their brain
Yeah.
and from the government.
Yeah,
Do you get that?
we get that.
Yes?
Yes.
Okay.
We have also about related to the delusions. We have a lot of jealousy delusions. Jealousy,
Okay.
because we have some precipitating factor, which is chewing gut. Chewing gut is very common in Yemen, and it's very common also to have jealousy delusion.
In Islam, no alcohol or drugs are allowed. But here, ghat is not considered a drug, even though there is a psychotropic effect.
First time to get a feeling. It needs about 3-4 hours after you get cut. Then you get a pushing feeling, very active, or perhaps a calming down feeling that you feel very tired. It's up to you.
Ghat is grown everywhere on terraced land and is sucking this desert country dry of its limited water resource. It also costs a lot, about 3/4 of a man's daily wage, which might be $10 or $15. And obviously, very little gets done when one is chewing ghat. What you do see are enormous wads in cheeks that are a status symbol indicating wealth and stamina.
We know that there is a relation between gut and this, but we do not exactly know this delusion. So if we have the other criteria of schizophrenia and related to duration, we diagnose as schizo.
Do the patients clear if you remove the gut?
They do not remove the gut. This is
They
the
won't
problem.
stop doing the gut.
Never.
Do you have any famous bipolar that are honest about their mental illness to the society?
No, they are trying to hide, of course. We even have some patient who was a bipolar disorder. He's not hypomania. He has a manic episode before. Now he is a traditional healer and presenting himself as a researcher in extraterrestrial things, spiritual things.
Right.
And he is treating people. He is seeing patients more than I see. We are treated mostly with drugs. We use most of the medications which are present, we have there. We have the two generations, the typical and the atypical, the new generations. We are using it according to the cost to the patient. When the patient is in the middle class, he can afford the prices for the new, we give the new, better for them. We start here to use the rehabilitation practices, but it's still in very limited experience, and we don't have enough staff to do that.
We students discuss with the patient to express bad feelings.
Okay.
Maybe help them to say a positive thing.
This all things is done by the patients.
Oh, okay, like art therapy
Yes.
and crafts. Yes, nice. So they make dresses
Yes.
and now, are they able to use this as a way to maybe make a living when they leave? As say a seamstress?
Yeah, we don't follow them really when they are going home, but I don't think so. It is just only for using their times.
Right.
Yeah.
Okay. Do the prayers happen 5 times a day in the hospital also?
The prayers? Yes.
And the patients, they
Counselor.
have a choice. They're not required to do that. But
They are not required. We actually think that this is important for, as a schedule. They are trained to do something which is scheduled. Maybe help them in the outside.
okay. The prayers.
The prayers,
and
yes.
the studying of the Quran.
Yeah.
Okay.
The prayers only.
Only the prayers.
The study of Quran is optional,
Okay.
if she likes. You can see the rooms.
Oh,
There are 7 bedrooms.
okay. Now, if someone gets out of control, are they restrained on their beds here, or do you have a special room?
No, we have special room.
Okay.
Special room there and there.
So if someone ends up in seclusion or restraints, they don't have to be observed?
No, they should be observed.
Do you have a state organization or a government organization that monitors the treatment of your patients?
No.
So you have no rules?
There is no rules. We are planning now to do rules for this, to follow something like the Muslim prescribing guidelines. This is a plan in the next few months here.
Do you feel that there's a risk that the patients can be abused here?
Yes, yeah, there is a risk. There is a risk. There is a lot of people there. If we restrain and the nurse maybe forget them, there's going to be a problem. So better for them to take medication, even if it's still aggressive, put it in the nursing room with the nurse.
Right.
It's better for them.
And they also have activities, just like the women's side?
Yeah,
They have
activities.
sports and crafts. Okay.
Psychologists, maybe 3 to 4 psychologists come in the afternoon for activities.
Okay. Great.
عشتي مرات زوجوني
شوية بس شوية
Okay.
شوية.
I'll look.
تقول 4 أنا أشتري 4
صورة
شوية كده.
لا تجي هنا وين أنت؟
لا موجود.
تشتيني دمعة هنا ولا؟
After our visit to the psychiatric hospital, my friend Hussein takes me to the one and only autism clinic in the country. Hussein's nephew, Baromi, has autism, so my friend is very active with this clinic.
Baromi doesn't speak much.
Okay, Baromi.
The clinic was started in 2005 by an amazing woman whose daughter, Sahar, was diagnosed with autism.
This is this Sahar Center. I make it by myself and by my money. I suffer too much when I found this center because I am the mother who have a child like autistic children. It's not. It is not easy to hide with autistic children. I study in Jordan University.
Okay.
I get master's degree.
So you started this for your daughter?
Yes.
Yes, we met her.
Oh, thank you so much.
So how has it been? Has it been going well?
Yes, she's getting better. She's very شديد. She's very difficult. Very difficult. But now she's better. She's working.
Yes.
Yes, she can hide.
Here, they try to keep up with the latest approaches in treatment, such as art and speech therapy.
ايش بتسوي يا ربي؟ الله ايش بتسوي؟ سوي اللون الاحمر احمر 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 مسكي.
Are they saying which color?
لا
Pick the red one and see if she Okay.
نفعل اول شيء شم الورده شمي الورده.
Okay.
يلا انفخي شمعة. لا لا هدي 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 يلا يلا حلو.
تمام.
لا اول حاجه احنا اول شيء عليك يلا. You can't because you want to see my face.
She has to see.
Oh, she has to see your face. Okay. Fair enough. Excellent. Good.
When she's alone, she uncovers. She takes over.
Yeah. I understand. Good. Wow. The staff here are mostly the family members of the children.
Every day, Monday through Sunday.
Because her son is autistic.
Right.
That's why she's here.
Yes.
And
But she's also had education in how to teach.
Yes.
Yeah.
Okay.
Most of them who are here, they're either relative is autistic or somebody's autistic and they want to do something.
Right. Autism has recently experienced much media coverage and controversy. Some have argued that it is not a so-called mental illness, but rather a neurodevelopmental disorder.
Well, it's my opinion that autism is a form of mental illness. It's in the DSM-4, which is the manual that we use to diagnose mental illnesses. And all mental illnesses originate in the brain, and they all have an organic feature. But because we don't understand it yet, doesn't mean that it's not a neurobiological illness.
Ultimately, whether chemical, genetic, or developmental, our brains are complicated and affect our moods, bodies, and behavior. The more we can understand about both internal and external influences, the more we can hopefully increase our tolerance and compassion for what we may simply perceive as different from the outside. Obviously, different countries, cultures, religions, and scientific achievements have influenced each other around the globe. And it is clear that historically and even today, the mentally ill have been misunderstood and mistreated. In fact, bigger questions can arise about what is mental illness anyway? Is it more about what you do rather than what you think? And perhaps who you can get to believe and follow you? My hope is that by sharing not just our advances in treatment, but also by increasing our awareness of each other's cultures, we can all learn to respect, accept, and help to heal this suffering that knows no borders. Please join me as we continue to explore mental illness around the world.